Dr. Hyman, thanks for joining us here on Health Connection. Our topic at this Health Connection post is the war on cancer. So the first question I'd like to ask is, have we made progress in treating cancer in the past 30 or 40 years?
We have made huge progress in treating cancer since the war on cancer started in 1971. The early detection rates are markedly improved and technology has just vastly improved our ability to find small cancers. Advances in mammography, in detection of small lung cancers, and in colonoscopies looking for small colon cancers have just been amazing.
What cancers, what types of cancers have we improved the most in terms of cure and survival rates?
We have improved, I have some notes here.
So if you listen, you got to look at your notes.
We now have improved to the point where 68% of adults live 5 years or more after they are diagnosed, up from 50% in 1975, and that's generically in all cancers. The 5-year survival rate for all childhood cancers is now 80%, up from 52% in 1975. The biggest successes: breast cancer rates fell about 28% from 1990 to 2006, while deaths from cervical cancer have dropped nearly 31%. Colorectal cancer death rates have fallen 28% in women and 33% in men. And leukemia death rates have fallen 15% in women and 10% in men. So those are some of the biggest successes that we've had.
Well, let me turn the coin over, the other side of the coin. What cancers have been difficult to improve upon in terms of survivability and cure?
Well, smoking-related cancers really remain a big challenge. Lung cancer and bladder cancer, and we have made marginal advances in those diseases.
What do we need to do to wage a more effective war against cancer than we already have?
Well, it's more of the same. We need more smoking cessation education. We need to get these young people to not start the habit because they are really setting themselves up for smoking-related health issues later in life, be it cancer or chronic lung disease or what have you. We also need to make a better impact on how many people are going for their screenings now that the screenings themselves are better.
With respect to young people that take up smoking, let's say somebody starts smoking in college and then quits relatively early. It's something they just do in college. Does that have an impact on their chance of getting cancer later or not?
We think that there's a threshold dose that you have to have, a minimum, before you really start having a significant impact in your risk for cancer later in life, and that is about 10 pack years. That could be a pack a day for 10 years, or 10 packs a day for 1 year, or half a pack a day for 20 years.
Okay.
That seems to be the minimum threshold amount that's necessary. So someone who just smokes for a couple of years and doesn't smoke a whole lot probably does not have a huge risk later in life.
Okay. Cancer rates are expected to increase due to our aging population, something that we
Yes.
hear. What is it about aging and cancer, and why the connection?
Well, we're finding out that the genesis of all cancer is from genetic changes. Those can be genetic changes you're born with, but more often are genetic changes that you acquire over time.
Okay. So
And
the
longer you live,
more time, the more chance of, okay.
That's right.
And is it really that simple?
It may be that simple, although there's great complexity in uncovering the very minute details that genetic changes entail, because it may be a series of genetic changes. It may be that they have to occur in a proper order. It may be that you have to inherit a susceptibility gene and then be exposed to something in the environment, like cigarette smoke or radon gas or whatever. And it may have to then have a secondary acquired genetic defect on top of what you're born with.
Okay, then a corollary question. Because we have improved the mortality rates on a whole lot of other diseases, and so as a consequence we are statistically living longer, does that simply expose us to carcinogens in the world that wouldn't have affected us because we lived shorter lifespans a generation or two back?
That's correct. We are having a greater and greater percentage of our population live to older ages, and we're seeing a shift in some of the cancer statistics because of that.
So you just hang around long enough, you know, the things that wouldn't have affected you, you died at age 50, you live long enough, they'll start to affect you.
Right.
Okay, that makes sense. How has genetic research impacted the diagnosis and treatment of cancer? We talk about, you know, the genetic research has just been, it's in everywhere you look. It's been very, very exciting. What has that meant for cancer?
Well, there have been some cancers whose therapy has been totally revolutionized by discovery of what the driving genetic defect is.
Give me an example.
Chronic myelogenous leukemia is driven by a genetic defect in the BCR-ABL gene complex. And we now have drugs that target that gene complex and normalizes their function once again, and it can turn around the disease.
How recently did this happen?
This happened in, it's been probably 15 years.
Okay.
And
Well,
it was really the first disease where the genetic driving mutation has been discovered.
Any other specific cancers where this is a factor?
Maybe. There are some genetic aberrations that are identified in many cancers, like P53 in lung cancer and EGFR mutations in colon and lung cancers, but these don't seem to be the driving genetic defects. These seem to be genetic defects that accompany some of those cancers. And so treatments targeting those genetic defects have not had this tremendous success like in chronic myelogenous leukemia. So we have to keep looking for the driving genetic defect and target our therapies towards that.
You may have opened up the next question. What does the future hold for genetic testing for cancer?
Well, the puzzle is there for us to solve, and we need to find the unique genetic defects in each cancer and have them be the driving genetic defect, and then we have to tailor therapies and design therapies that will get those genetic defects back towards a normal expression.
Some have predicted a vaccine for cancer. How likely is that?
One of the problems with vaccines is that if you inoculate against an antigen on a particular cell, that antigen or something that looks very much like it is probably on a normal cell that we don't want to damage. So you get crossfire.
Okay.
It's the same problem that we have with regular old chemo. Regular old chemo is a poison that will poison any cell that drinks it in, be it a cancer cell or a normal host cell. And so vaccination is probably not going to be the way. Genetic therapy is probably going to be the key to treating cancers.
Okay. We think we'll ever find a cure for cancer? That's kind of a broad, there's so many different types of cancers, but will there ever be a point where you just say it's a cancer and I can cure it?
I think for some cancers that will be the case. I think that it depends on when the discoveries of these genetic factors occur. It also depends on how successful we are in getting rid of certain carcinogens from the environment. If we can control sun exposure, we'll reduce the risk of melanoma. If we can control cigarette smoking, we'll get rid of several cancers. We won't get rid of all of them, but we'll get rid of the majority.
Very well. Doctor, fascinating stuff. Thanks for your time.
Thank you.